In this video, we'll examine some common mistakes made when talking with youth about substance use prevention. We'll present an alternative approach based on an evidence-based communication method called motivational interviewing. Motivational interviewing, or MI, is defined as a particular way of talking with people about change and growth to strengthen their own motivation and commitment. Central to MI are four foundational elements, often referred to as the spirit of MI: acceptance, compassion, partnership, empowerment. Start with acceptance and compassion. The topic of substance use can evoke strong feelings of disappointment, fear, anger, and judgment. While these feelings are normal, you must be careful about what and how you communicate with young people. Expressing these negative emotions can be counterproductive to your goal of promoting healthy choices and can damage your relationship.
A good way to start is to remind yourself that the young person's safety and well-being is your priority. Then communicate that care in a way that is authentic to you. For example, you might say, "I care about you and I'm concerned about your safety. Can you help me understand what's going on? I'm here to support you."
Use non-judgmental wording and tone, and ask open-ended questions to explore the behaviors and underlying reasons for their substance use. Be mindful that the young person may be dealing with mental health issues or adverse childhood experiences, or ACEs, that can affect substance use.
Accepting them without judgment does not mean agreement or acceptance of their actions. It shows that you respect their perspective and express genuine empathy for their experience. This approach helps reduce shame, which can lead to stigma and become a barrier to someone getting help. It can harm the person's mental health, causing isolation, loneliness, and depression. Collectively, stigma can lead to groups of people being stereotyped and discriminated against, causing criminalization or excessive punitive disciplinary actions based on race, gender, age, and income.
Avoid using language that blames or shames the person. For example, "You don't use drugs, do you?" Or, "How could you be so irresponsible?" These are not effective ways to speak with young people. While reducing stigma, be careful not to endorse use unintentionally. Don't promote the perception that everybody is using. Instead, try to normalize conversations about drug use and establish non-use as a health standard.
Encourage partnership or collaboration. Like many adults, you may feel the burden of being the authority or expert in the room. Many of us grew up with this model, but as we now know, the just saying no approach and harsh punishments are not effective. The American Psychological Association concluded in 2008 that such policies run counter to our best knowledge of child development and have created unintended consequences for students, families, and communities.
The most productive conversations happen when you elicit a two-way communication and acknowledge them as experts. They are experts in their lived experience and their goals and values. Understanding their perspective will help you guide them towards healthy choices that align with what they care about. Also remember that today's youth are smart and well-connected, with an enormous amount of information at their fingertips, not all of which is trustworthy. They will likely see themselves as experts on the topic, so your respect and collaboration can open a door for you to offer guidance as they navigate this complex information landscape.
Empower with honest, transparent, science-based information, not scare tactics. Always give the real facts to equip youth with the information they need to make responsible choices. Never use scare tactics because exaggeration undermines trust and credibility. Youth easily see through scare tactics and often know more about drugs than you assume, whether through family exposure, peer exposure, media, or other means. They stop listening when there is a disconnect between what you say and what they see. Moreover, scare tactics can appear manipulative and make you seem hypocritical when you educate them about the deceptive strategies many companies use to market their products.
It is also important to provide the full picture of the effects of drug use. Often, these conversations are limited to the risks involved, but there are perceived benefits that the young person may have experienced or observed. For example, substance use can be enjoyable as young people spend time with their friends, feel more comfortable in their skin and surroundings, or avoid boredom. Instead of focusing only on risks, you can describe both the risks and perceived benefits of a drug. This boosts your credibility and leads to a more nuanced and impactful conversation. Be informed about the effects that various drugs have on the body so that you can explain clearly their impact on physical, mental, and emotional health. If you don't know something, it's okay to say, "I don't know, but I will find out." Then follow through by looking up credible information.
Reality-based harm reduction strategies. We must anticipate that youth may not make the choices that we want them to make. Knowing this, it's important to provide them with harm reduction strategies to keep them as safe as possible. We like to think of this like wearing seatbelts or helmets, and it could save a life. Teach them how to reduce their risk at various decision points. For example, the safest choice is to not use drugs, regardless of past use. If they decide to use, they might consider waiting until their brain is done developing or consider cutting down. If using, they should take additional steps to reduce harm, such as learning about the substance's effects, risks, perceived benefits, and drug policy. They should also check the dose and dosage, never mix substances, and whenever possible, test for drug adulteration. Additionally, they should assess their mindset and the physical and social setting before using. It's also important to know what to do in an emergency, such as administering Narcan for an opioid overdose.
Embracing the principles of motivational interviewing can significantly enhance your ability to encourage healthy choices. By allowing space for acceptance and compassion, cultivating a partnership, and equipping individuals with truthful, evidence-based information, you can establish a relationship rooted in trust and mutual respect. Remember, our goal is not just to inform, but to engage in meaningful conversations that respect the young person's perspective and genuinely support their self-efficacy and well-being.